Thank you very much, Maria, and thank you very much, Wendy, and all of the COLDA Steering Committee for having myself and Sven here representing EASL, and of course Maria is an ex-governing board member as well, so it's wonderful to be here, and I've actually found it very moving to learn so much about what's going on in Africa, and it really makes me want to now move forwards with EASL to have a stronger collaboration and to work more closely together. And I know I've spoken to many of you in the room who are very keen to develop collaborations, and I hope we can do that. So my email, Wendy can always share it. I'm very accessible if anybody wants to have conversations. But what I've been asked to do today is to talk to you about healthy livers, healthy lives in this session, and particularly to focus on MASLD, but I'm also going to talk about liver disease generally as a non-communicable disease. We've learned a lot about communicable diseases so far in this meeting, but actually non-communicable liver disease is very important. And I'm just going to share a little bit at the end about the Metabolic Health Roundtable series that's recently happened. I've actually got no specific disclosures in relation to this talk other than that I'm EASL Secretary General, and so that if there's an EASL bias, I apologise. So what is Healthy Livers, Healthy Lives? So the Healthy Livers, Healthy Lives initiative, it's a global coalition. It was actually founded initially by EASL, but actually it's now involving all of the sister societies. And what we're trying to do is unite liver associations around the world to combat liver disease through policy action, public health campaigns, and scientific advancement, just like we're doing in this meeting today. And the coalition is very new. It was formed only 4 years ago. But what we want to try to achieve is to raise awareness and advocate for policies that promote liver health, and also to prevent conditions such as MASLD, alcohol-related liver disease, and of course viral hepatitis, which we focused a lot on in this meeting. I'm just going to give you just a few of the objectives from Healthy Livers, Healthy Lives. And as I've mentioned, it's a global collaboration. And really, we want very much to focus on public health and policy action across the board, and to really raise awareness around the globe of liver disease. We want to focus on prevention. We've heard a lot about, unfortunately, patients presenting with very end stages of liver disease, and actually we want to bring that back so that actually we're better at identifying cases of liver disease early when we can actually intervene, and we want to advocate for that. So I'm going to focus a little bit, first of all, in my talk on non-communicable diseases. And why a non-communicable disease is important? Well, obviously, communicable diseases we know are very, very important in Africa, but actually, non-communicable diseases killed 43 million people in 2021. That's equivalent to 75% of non-pandemic related deaths globally. So it's a big deal too. And 18 million people died from non-communicable diseases before the age of 70. And particularly, 82% of those are focused in low and middle income countries. So people in Africa are not just dying of hepatitis B and HCC, they're also dying of non-communicable diseases. And I think that's really important. Of all of those, cardiovascular diseases still account for the most deaths, 19 million deaths, followed by cancers. And of course, that will include HCC, chronic respiratory disease, and diabetes. And really, this is what we want to try to address with detection and screening. And we also mentioned this morning in our capacity building session with Mark also about palliative care also being important for these patients. So steatotic liver disease is probably centre stage in the NCD epidemic, and that's what I really want to focus on today. And steatotic liver disease affects 1/3 of the adult global population. That's 1/3. And obesity underpins the majority of that. Most NCD deaths occur between the ages of 30 and 70. And I've talked about cardiovascular disease being very important, but also diabetes, and I hope I will persuade you liver disease is just as important. But what's really worrying is it's affecting our children. Globally, between 7 and 9% of children, particularly those that are obese, are walking around with metabolic-related liver disease. And that's a catastrophe, because it means that these people will go on to develop cirrhosis, HCC, and if they're infected by hepatitis B, that just compounds things. It's just an absolute disaster. So we really want to get that on everybody's radar. Just to give you an idea, this is a map of the prevalence of obesity around the world. And you can see that there are certain hotspots. The dark blue areas are the bad areas. And you can see that a lot of Africa isn't dark blue, but in North Africa and in South Africa, it's particularly an issue. But across Asia and of course all of the westernized countries, it's a huge issue. And all of these individuals will go on to develop metabolic syndrome. And, you know, obesity kind of underpins the development of metabolic liver disease. This is a diagram here just to show you how it all fits together. But obesity is really centre stage, and MASLD falls really within that. And all of the complications and issues that are associated with having metabolic syndrome. And we forget that people also go on to develop obstructive sleep apnea, you know, heart disease, all of those things, depression, eating disorders, it's all associated. You know, type 2 diabetes is probably central to the development of liver disease and metabolic liver disease. Not everybody who has diabetes will go on to develop metabolic liver disease, but you can see that a good 65% will, 32% will get steatohepatitis, and 15% of those will go on to get advanced liver fibrosis and cirrhosis. Now, recently, we had a change in nomenclature. We used to associate metabolic liver disease with fatty liver disease. We used to use the term fatty, and we realised that really wasn't a particularly nice term. It was stigmatising, and a new nomenclature was developed. And you can see that actually now we can use decision support tools, really, to try to categorise or subcategorise steatotic liver disease. I think what's important with this new nomenclature is we've recognised that metabolic-associated steatotic liver disease is important, but actually alcohol also may play a part with MetALD as well. And it's very common for patients with MASLD to also be drinking excess alcohol, and that compounds things. But also there are other contributors to steatotic liver disease too, which are equally important to recognise. And this is some data that shows the prevalence of the different types of steatotic liver disease. Unfortunately, there is no Africa data here, but you can see that roughly across the globe that steatotic liver disease is occurring in about a third of the global population across the board, even higher potentially in Asia and North America. But also MASLD is following that, and MetALD with a component of alcohol. And alcohol-related liver disease obviously is a lot less, but I think it's still very, very important, and I'll talk more about that in a moment. And alcohol, I think, is important. And I know when I visited one of the local hospitals in Kumasi, actually I was seeing patients, you know, withdrawing from alcohol on the wards. So I know that this is an important issue too. But particularly metabolic liver disease, when alcohol, you know, it comes into the mix, it is a huge issue. And it's very important, I think, that we've brought that into the terminology and the nomenclature to recognise that people who are overweight and have MASLD may also be drinking alcohol, and it's very, very important to screen for that. And, you know, alcohol is an important risk factor, along with adiposity and diabetes and dyslipidemia and arterial hypertension. And this is just a little diagram here just to show the relationship. But you can see that the background alcohol use is important, particularly in areas where that is more of an issue, and we want to address that. But also, it's important to say that alcohol also compounds a lot of the cardiometabolic issues that patients with MASLD have in terms of it drives more weight gain, it worsens diabetes, it increases blood pressure and hyperlipidemia, and that is a real issue. And if you can address both these things, it's very, very important. And so really, in any recommendation for assessment of anybody with metabolic-associated liver disease, it's really, really important to assess alcohol intake. And I won't go through this chart in the interest of time, but you can see that an alcohol assessment is always important to do, or at least to ask the question. So please do think about that. But also there's a strong link not only with MASLD, but also with alcohol and other non-communicable diseases in driving cancer, in driving cardiovascular disease, in driving liver disease, pancreatitis, and so on and so on. And these are some data that have been put together in a paper, and it's really supported the WHO in wanting to also implement strategies not only to counteract the rising incidence of MASLD, but also alcohol-related liver disease too. And one of the things that's quite scary for me, and this is actually a global issue, is that these are data from the health behaviour in school-aged children. It's an international report across the world. What's scary is that our children are drinking alcohol far more than they used to do. Sadly, right at the top of the chart are European countries. Denmark is the worst, can you believe? But, you know, 15-year-old children, 84% of girls and 83% of boys are regularly drinking alcohol. And that is just terrible. And I wonder what the data are here, but it's frightening. And just to make you aware that this is going to drive the earlier development of liver disease. And these are just some data that show even 11-year-olds in some countries, particularly Eastern Europe, are drinking alcohol regularly in this survey. In the last 30 days, can you believe 13% of 11-year-olds had drunk alcohol? It's really, really scary reading. So, you know, what can we now do in terms of strategies and policies to address MASLD? Well, this chart for me says it all, okay? Because look at, these are all the major regions, including sub-Saharan Africa, and you can see that there are 0 strategies to counteract MASLD anywhere in the world. Can you look, naught out of, it's just frightening. There is no, there's no strategy, there's no consensus to address MASLD, obesity, alcohol. It's just awful. And so we've got a lot of work to do as a community because this is important. And not only that, but we also need to expand awareness of steatotic liver disease as well. And what that's going to mean is actually needing us talking to our colleagues. You know, we need to speak to dietitians and general physicians and public health doctors and caregivers. We need to make everybody aware that this is an issue. It's not just something that hepatologists need to deal with. And I think up until now, we've very much felt that, but actually we need to spread the message throughout the community and work together. And with that in mind, one of the things that was recently set up, and Jeff Lazarus was at the forefront really of this, is that we set up a number of global metabolic health roundtables. And these were really addressing the public health threat of MASLD and MASH, but also other metabolic diseases that I've talked about around the world. And it was sort of initiated by a World Health Assembly event in Geneva back in May of this year, where we really recognised this problem. And then 3 metabolic health roundtables were held, one for Latin America, one for Middle East and North Africa, and one for Asia and the Pacific. And really what we wanted to do was to sort of spread the message and gather momentum really, so that actually we can put pressure on the UN high-level meeting to recognise liver disease, particularly steatotic liver disease, as a non-communicable disease. And I'm leaving tonight to go to New York to join that meeting. And it's going to be, I'm not sure I'm going to be listened to, but you know, we're going to give it a go. And I think we need everybody in the room to really get behind this, and it's going to be very important. And it's going to follow up with the World Health Summit in Berlin following that. But we really need to recognise it as a core NCD. In the Global Metabolic Health Roundtable series, you can see that 3 meetings were set up with a number of speakers and key opinion leaders and participants. But actually, there was a good spread of countries in those regions that really try to address these issues and put things on the table, and really to have a call to action to advocate for steatotic liver disease being an NCD. And some of the key themes that were talked about was obviously chronic liver disease being a public health priority. I've talked about it. I don't really need to go through this again, but also the systemic challenges that nations face and regions face in developing region-specific guidelines and non-invasive diagnostic tools and awareness among healthcare professionals. And some of us in the room, Torsten, if he's here, we've been trying to look at ways that we can do early detection of liver disease in Africa, for example, and that would be a good example of that. But also this continued absence of international policy documents, we need to put that to an end and really get things on the table. We were able to identify in this series a number of barriers to implementation, and commercial determinants of health is a massive deal in that we can't do half as much lobbying as industry does for things that are bad for us to eat and drink, sadly. Any meeting, there's one hepatologist and there's 20 people lobbying for Coca-Cola and, Mars and all of these big companies. And it's very, very difficult to get our voices heard, but we need to still do that. And of course, sometimes there's fragmented political will and instability, and we've talked about all of those issues in relation to hepatitis B and HCC in this meeting as well. So it's not just this. But also what we wanted to do is really to develop a roadmap for success so that we frame the issues within the global NCD agenda and potentially leverage existing platforms. And there's a number of things that have been developed by the WHO, best buys and quick buys, and things that actually we can really highlight and help us to get to where we need to be. But as I say, there's a lot of work to be done. And so what's happening next week in New York is that there's the UNGA, the UN General Assembly. It's the 80th General Assembly, but there's going to be a 4th high-level meeting that's going to be particularly looking at NCDs. And what we want to do is be there to really highlight why liver disease needs to also be on the table. And I think just raising liver as being important in policymakers' minds helps with communicable as well as non-communicable diseases, because liver often gets forgotten. And with that, I know that some of you in your talks have talked about World Hepatitis Day, and I know that's a big thing that's celebrated around the world, and you use it as a great tool. But I also want to just highlight to you, we also have a World Liver Day on the 19th of April, which all of our sister societies, and I know Wendy's at the heart of it in SOLDA, in that we try to get liver disease on the table and recognised. This year we celebrated food is medicine as our particular theme. So please all get behind this if you can, just to get the message out. But some of the things on, we have a website, worldliverday.org, which any of you can access. And it's actually very helpful because you can access really good tools and resources that can help you spread the message in your own communities and countries. And it includes things, like myth-busting issues and healthy recipes and lots of fact sheets and things that you can use. And this is heavy data slides, but lots of examples of things that you can use as tools, videos, testimonials, policy dialogue, statistics. It's all available. So please do have a look there and potentially download things. And you can see that we had, I think, on World Liver Day, about 6,000 page views. So people were looking at this and clicking, and there were some top country visitors: India, United States, UK, Bangladesh, Nigeria's there as number 8, so thank you, Nigeria, for really engaging. And it really, really helps to get the message out there. And we had a big social media campaign, and you can see there was really a lot of engagement with things. And we hope that in 2026 that we can beat that too, in terms of press as well. So what are the next steps really? Well, we're going to go to the, I'm going to go back a minute. We're going to go to the United Nations and we're going to try to make the case for liver disease. But I think this is going to be a work in progress that we're all going to have to contribute to for the next, 5 to 10 years. And there's no easy solution to this. It's just the more, somebody said to me and my team that, if you throw mud at a wall enough times, it eventually sticks, which, so if we do this, then hopefully the message will finally get through. So I'm going to finish there really, other than to say the EASL Congress is happening in Barcelona at the end of May next year. You are all most welcome to attend. We'd love to have you with us, and we will do anything to facilitate you coming. I know Wendy might talk about this more, but EASL is going to fund 3 fellowships for SOLDA members who have the best abstracts to come. We will pay for 3 people to have a fully paid trip to the Congress, all expenses, and EASL membership. But actually, for many of you, EASL membership, if you're a low and middle income country, EASL membership is free, okay? So please, if you want to join EASL, click on the QR code. You're most welcome. And emerging economies, it's €25. So I'd really encourage you all to join. I know I was talking to Paul a moment ago before I started talking, and he was telling me how much he's got out of joining EASL, and we'd just love to make it a two-way relationship. And I'm going to stop there. So thank you for listening.